Could we do the left leg, please?
Yeah, that's pain.
All right.
There.
Any pain in the lower back?
A little bit on the left side.
On the left
Yeah.
side. Any sensitivity when I push on here?
Yes.
Yes. L5S1, disc space is still the most sensitive. Can you raise the right leg from your hip, please? Sensitivity in the lower back? No. Okay. That's a massive difference. Exhale. Inhale. Exhale. Inhale. Exhale. So normally with patients, we do lower back stim. Can you raise the right leg from the hip? Okay, much better. There we go. That's equal. Just stop here. Don't push too hard.
Okay, so
Let's check the nerve tension now on the left leg.
oh wow.
Much better, eh?
Yeah.
There we go. That's what we're
Awesome.
looking for.
Brilliant.
What's up, everybody? Dr. Ranen here. Today I have a very special guest. I have my friend and colleague Ashley in with us. Ashley is a sports therapist based in Dubai. She's also the physio for a rugby club called Hurricanes Rugby Club here in Dubai. So Ash came in to see me on Monday. This is actually a very interesting case, a very nice case for you guys out there. Because we have a patient that's in the midst of a very painful episode of discogenic pain. So Ashley came to me on Monday with acute lower back pain and inability to weight bear on her left leg. It started on Saturday,
Yeah,
yes?
Saturday, yeah.
Started on Saturday, wasn't really getting any better, wasn't getting any worse. She tried to do some soft tissue therapy. There was no real improvement, so we got in and assessed her. Now, Ash was not experiencing any nerve pain or radicular pain, but we started off with a neurologic examination. We started to find dysfunction there, which kind of built up our diagnosis. So we're going to start with a neurologic examination today. We're going to check if everything is working as opposed to what it was a few days ago, and then we're going to go from there. All right. Also, just to add in, we started off with some spinal. Part of our first session was spinal decompression therapy. We did some intramuscular electro stimulation. I worked several aspects of her lower back and nerves around the lower back. Ash has been doing some McKenzie dynamic technique, which I will try and show you guys a little bit of today. And overall, you're feeling much better, yes?
Much better, yeah.
We
Better.
also added in an anti-inflammatory. Now I know chiropractors essentially are supposed to be medication-free, but I really believe in the use of anti-inflammatory medication when needed, when warranted. Short duration use of NSAIDs can be very beneficial, and we saw an improvement in night pain and morning stiffness, which were the two biggest issues, yes?
Yeah.
All right, so we're going to get in and assess her. Please hit the like button, subscribe, and if you have any questions or comments, please drop them in the comment section, guys. Okay, let's go. So here you see we have a little bit of hyperreflexia. Okay, can you feel that?
Yes.
Can you feel that?
Yeah.
Can you feel this?
Yeah.
Same both sides?
Yeah.
So at the last session, you could not feel
On the
this,
outside,
yes?
yeah.
Okay. Lift your toes up for me, please. I'm going to push down, resist. Good. I'm going to push down, resist. Push, push, push. Okay. And bend your toes down. All right. Hold for me. Hold, hold, hold. Good. Hold for me. Hold, hold, hold. Much better.
Yeah.
So we've seen a slight change in neurologic examination. At the last session, we had hyperreflexia in both patella tendons, and this is assessing the L4, L5 nerve root. We had loss of sensation of S1, which is here, and we had weakness of the flexor hallucis longus, which is when you push this toe down. As the symptoms have gotten better and as the inflammation has reduced, we're seeing the symptoms of irritation more localized to the L4, L5 level. So sometimes if you have an injury at L4, 5, because of the way the nervous system works, you can have an irritation of the levels below or above. In this case, it was below. So we're seeing here, patellar reflex is a little bit more and slightly weaker extensor hallucis longus, okay? But not too bad.
Yeah.
It's kind of plus minus.
Yeah.
Okay, let's check out your nerve compression test. Straighten your right leg for me, please. Oh, that's much better.
Yeah.
Yeah.
Although I feel that immediately.
You feel it on the left side. So on Monday, we basically got up to about 45 degrees.
Yeah.
Ash could only get there, and then the leg was shaking quite significantly. Now we're getting up to 90 degrees with referral onto the left side. Could we do the left leg, please?
Yeah, that's pain.
All right.
There.
So this is essentially what we were seeing on Monday on the right side.
Yeah.
Yes?
Yeah.
Okay. All right. Can I get you to stand for me, please? So that's a slump test. It's a nerve root compression test. You're going to face that way, please. Any pain in the lower back?
Yeah, left.
Left side.
Yeah.
Okay. Any pain in the lower back?
Little bit on the left side.
On the left
Yeah.
side. Okay. Any pain here?
That's okay.
That's okay?
Yeah, that's not so bad.
All right. Any pain here on the left side?
Tightness left, but not necessarily
tightness,
pain,
okay.
yeah.
Here?
No.
No. Okay, let's get you to sit for me and then lie on your back. So when we do the slump test, when Ash straightens her right leg, we see referral of pain onto the left side. When we start doing our range of motion testing, so extension, rotation, lateral flexion, everything we do on the right side refers pain onto the left. This is a good indication of a broad-based disc injury, which is worse on the left side. So every time you put pressure on the right, it's going to increase the tension onto the left nerve roots and cause symptoms on that side. So it's just a few tricks we can use to classify the type of injury a patient is experiencing. Leave your leg loose for me, please. Starting to feel tight.
Yeah.
Any sensitivity on the left side?
No.
Just tight.
Yeah.
Okay. So this is a little bit better.
Yeah.
On Monday we were around here.
Yeah.
All right.
If that.
Yeah, if that.
It's pretty bad.
Okay, let's do the left side now. Relax for me.
Oh. Tight there.
Okay, much better.
Yeah.
Sensitive in the lower back or just tightness in the leg?
Little bit sensitive, but nowhere
Okay.
near the other day. Yeah.
Can you hold your leg for me?
Yeah.
This
Hold
one,
it.
yeah, just hold it
down.
like this. Yeah. I'm gonna push down, resist, resist. Okay. Hold for me. I'm gonna push down, resist. Okay, so that was manual muscle testing of the rec fem and psoas. On Monday, Ash wasn't even able to engage the muscle. Now she's able to engage, but she's unable to resist.
Yeah.
So there's some improvements there as well. All right, let's get you face down for me. All right, so this is L4. This is L5. And this is S1. Okay. Any sensitivity when I push on here?
No.
Any sensitivity when I push on here?
Yes.
Yes. Any sensitivity when I push on there?
Less.
Less. Okay. Which one's most sensitive? 1 or 2? 2. Okay. So L5S1, disc space is still the most sensitive, even though most of the symptoms today are showing irritation of the L4, L5 nerve root. All right, let's have a look here. Okay. Can you raise the right leg from your hip, please? Any sensitivity in the lower back? Okay. Left leg? That's a massive difference. And relax. Okay. So, passive hip extension test. If you notice, the left leg doesn't raise as much as the right leg. The passive hip extension test is a good indication of dysfunction, joint dysfunction at the level L5-S1. Okay. All right. Any sensitivity in here?
Yeah, both sides.
Both sides. All right. Any sensitivity in here? No. Okay. Any sensitivity here?
No.
Any sensitivity here?
No.
Any sensitivity here?
No.
Here.
No.
Okay. Any sensitivity here?
No.
Any sensitivity here?
No.
Any sensitivity here?
Yes.
Yes. Any sensitivity here?
No.
Okay. All right. So, not too bad. No neural sensitivity around, along the leg, besides for a little irritation here at the posterior femoral cutaneous nerve. This is one of the nerves which is a branch of the sciatic nerve and of the lumbar plexus, and it can give some irritation to the outside of the leg. So what we're going to do today is decompress the lower back, pretty much a continuation of our therapy on Monday. Decompress the lower back. We're going to do some intramuscular electro stimulation in the lower back, and we're going to work the leg today. I did not work the leg the last time because there was a lot of sensitivity around the lower back. Today we're going to try and work the leg, and we're going to see what difference it makes on our slump test and our straight leg raise, because we need to start reducing that nerve tension. We're also going to teach Ash some nerve flossing techniques today. All right, guys, if you like this video so far, please hit the like button. And if you have any questions, drop them in the comment section below. You ready to go, Ash?
Yeah, it's good.
All right. All right. You ready to go?
Yeah.
Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale, and relax. Okay, for those of you who are new to the channel, this is an impulse adjuster, and it performs the same function as manual spinal manipulation. This could be described as static spinal manipulation. You are not setting a patient up as you normally would. You're not getting that nice pop or crack. Now, normally I would use this in between my rounds of decompression. This is to activate your multifidi muscles, which are spinal stabilizing muscles. But in Ash's case, we're not going to be manipulating her lower back for the moment. So we also want to bring about the effects of the manipulation on the joint. Inhale, exhale. Inhale, exhale. Keep going. And the effects of manipulation on the spinal joints are inhibition of pain or pain management. And relax. Now, why will I not be manipulating her lower back? Well, in this case, because of the nerve tension in both legs, which is quite severe, I'm not sure how bad the disc injury is. The assessments that we do are not an indication of the size of an injury. It's just an indication on the severity. You can have a very small lesion or injury with quite big symptoms. You can have a small injury with, you can have a small injury with large symptoms, or a large injury with small symptoms. So we always want to be cautious. Once the nerve tension subsides, Then I'll go ahead and perform manipulation of the lower back. What I don't want to do is make a large injury any worse. Inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale. All right. You good?
Yeah.
So Ash and I have been working together, I guess, for the last 2 to 3 years.
Yeah.
We share a lot of patients. Those of you who've been watching my channel will know Scarlett Harvey, the professional strongwoman. She's a patient of both myself and Ash. And yeah, by working together, we can co-manage patients in the best possible way.
Saturday I said I'd go just because there's no one else. And
Yes.
then I'm going to have one of my friends who's an ex-player.
Mm-hmm.
She'll do all the running. I'm just going to park on the side of the pitch for any
Okay.
catastrophes. Yeah.
So as I mentioned before, Ash is a physio for a rugby team, and this means that she needs to be at the games to run touch, basically. And this is to observe the players and to assess any injuries that may happen during the game. Now, an injury of this nature generally takes 7 to 10 days to settle in acute nature. This means that pain will go from 7 or 8 out of 10 all the way down to maybe 2 or 3 out of 10. But because of the job that Ash does, which is quite physical, it means that she's going to need to take some time off work. This type of injury may not have affected a corporate worker as badly. All right, let's get going here. Inhale. Right. Inhale.
Ooh, nice.
Nice, yeah. Can you feel that?
Yeah.
Light, mild, or strong?
Mild.
Still mild?
Yeah, I could probably go more.
How's that?
Yeah, that's good.
Good. All right, so that's a good sign when patients can handle an increase in impulse between sessions. It means that they're becoming less sensitive. So for those of you who are new to the channel, this is called percutaneous intramuscular electrostimulation, or just intramuscular electrostimulation. It is a combination of dry needling and electrostimulation. Now this device produces a current called TENS, or transcutaneous electrical nerve stimulation, and what that does is it increases muscle strength and it reduces pain. So with the dry needles or the acupuncture needles, I am basically, the location I'm at is into the multifidi muscles. These are the muscles that are stabilizing the spine and the vertebra, and I want to increase their strength and offload the disc. Passing through the multifidi muscles are the medial branch of the posterior spinal nerve. I will show you a model of this. So this is the posterior spinal nerve. It has two branches. One goes forward, one comes back. The one that comes back transverses back like this into the surface of the skin. This is called the medial branch. And passing, or the medial branch essentially passes through the multifidi muscles which attach from vertebra to vertebra. What I want to do is I want to target this nerve and perform a nerve block or a pain block using the electrostimulation. So we're kind of feeding two birds with one seed here. How's that stim? Can I increase?
Yeah.
Yeah. So normally with patients, we do lower back stim, and if they're having nerve pain, we do nerve stim at the same time. But with Ash, we're going to break it up because due to the size of the injury, it becomes increasingly uncomfortable to be in one position for a long time. So we're going to do the stim, we're going to get it to walk around for a little bit, sit for a little bit, and then we're going to move on to the next stim. Okay, so far so good?
Yeah.
Great, great. Okay, so we're just going to pop off the electro stim now. So let's just assess your nerve tension.
Yeah.
Can we do the left leg, please? Still biting, eh?
Yeah.
All right, let's get up and walk around for me, please.
We'll just be in that
Yes. So treating and reassessing is very important, so we get an idea of what's working, what's not working, what we need to do more of, what we need to do less of. And when you have a patient with quite an acute disc and night pain, we know that being in one position for a long period of time increases the irritation of the disc, and the disc likes changes in pressure. So getting the patient to stand and walk around, move around a little bit, makes him feel a little bit more comfortable. You good?
Yeah, good.
Okay, let's get you face down again for me, please. Okay, guys, so I'm going to work on Ashley's left buttock and leg. Obviously, for privacy purposes, we're going to cut the video here, but we're going to be back shortly. If you like what you're seeing thus far, please hit the like button, guys. If you have any questions, drop them in the comment section below. See you soon. Okay, guys, so we've just done an intramuscular electrostimulation on the left leg. I did glute med, glute min, glute max, and the hamstring. Passing through these specific areas are certain nerves that feed back to the lumbar plexus and the spinal cord. And this stimulation will encourage the muscles to be stronger, but also encourage a reduction in nerve sensitivity. So we're just going to do some vibration therapy. What this does is it helps to fragment the nervous system. So it helps to kind of break pain patterns and pain pathways. And I like to couple this with my electrostimulation. I do the electrostimulation first, and then we do the vibration therapy. You can couple this with various different techniques. You could use laser therapy, you could use cryotherapy. And it really makes a big difference in reducing pain and discomfort. And what we do is we always move towards the spine. We call this a centralization of pain. We want to push the sensation back towards the spine where the spine can deal with it better. All right, let's just have a look at your leg length. Okay, it's much better. Let's check your hip extension now. Can you raise the right leg from the hip? Okay, down, and left leg. Much better. There we go. That's equal. Okay. All right. Can you straighten your left leg now, please?
Yeah.
Much better.
Yeah.
There we go.
Yeah.
All right.
Awesome.
Let's get you on your back, please. Okay, so what we're going to do now is some neurodynamic technique. Can you straighten your legs for me, please? All right, let's have a look here. Leave it loose. Much better, eh?
Yeah.
Much looser.
Yeah, that's really
So
good.
we were getting stuck around here. It was generating quite a bit of sensitivity. Now we can get all the way up to 90 degrees.
Yeah,
So
awesome.
what we're going to do is some neurodynamic technique. Just leave your leg loose for me. It's called nerve flossing. And what this will do is it will move the nerve where it is being impinged. It's a nice way to free the nerve up. So you can add this in
With the
Mackenzie.
Okay,
Leave your leg loose for me. There we go. So you can do 10 reps
okay.
of your Mackenzie and then 10 reps of nerve
this.
flossing, or you can
Okay.
just get your 3 sets done and then through 3 sets of nerve flossing.
Okay, cool.
Okay,
And you're turning the foot in.
I'm not turning it in.
Oh, no,
I'm
no.
plantar
Yeah,
flexing.
yeah,
So
yeah,
plantar
okay.
flexion
Okay.
and then extension with dorsiflexion.
Got it. Okay, cool.
So I'm starting off here. I'm ending at around 70 degrees
Yeah.
because I don't want to create maximum tension on the nerve as yet.
Yeah.
Okay.
Yeah.
So you're going to try this for me. You're going to interlace your fingers.
Here?
Yes.
Yeah.
Just interlace them. Your toes down.
There.
Okay. And then
And
extend. Yeah. So just stop here. Don't push too hard.
Okay, so I'm not
Okay,
trying to straighten
yes.
necessarily.
1 second. Lift your head for me. All right. There we go. So just hold your leg a
Do I
little
need
bit
to-
lower down.
Oh,
There we go. Yeah.
And that at a 90 degree.
Yes.
Yeah, okay.
Extend. That's much better. Slow at the top. There we go. Toes down. Great. All right.
Yeah.
Great.
Cool.
Let's get you to turn to your side for me, please. And you can sit for me, please. Okay. Let's check the nerve tension now on the left leg.
Oh, wow.
Much better, eh?
Yeah.
There we go. That's what we're
Awesome.
looking for.
Brilliant.
Let's just check your strength of your big toe and your reflex. Much better.
Oh, yeah.
Still got some hyperreflexia, but not too bad. Let's lift the big toe up for me, please. And hold, nice and strong. Hold, hold, hold. Up, 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 up. Up. Okay, all right. We got some work to do there.
Yeah.
Okay. Okay, guys. So we're going to end off our session today by applying a topical anti-inflammatory cream. This one is called Scream Zero. It's something that I've just started to use on my patients, and it's actually produced by Ash. So we will put a link on the screen, maybe here, or down there, where you can get access to Scream Zero. And what you have in here is menthol crystals, beeswax, arnica, coconut oil, and a whole lot of other good stuff. So It's nice and lubricating, but it is not as oily as a normal oil. All right. I'm just going to go ahead and apply this onto the skin. Ooh, that's got a really, really nice smell.
Yeah.
Okay. How much do you generally like to apply onto?
I mean,
an
to be
area?
honest, you really don't need a lot because it goes
No.
a long way.
Yeah, so you can look at that.
Yeah.
It looks quite oily in my hand, but when you apply it to the skin, it absorbs
Yeah.
quite.
Yeah, it's like
Quite a
like a
bit.
balm, and it
Yeah.
works well with like scraping tools and just kind of trigger pointing and deep tissue treatment. It's really good.
Nice. Okay. Okay, guys, that brings an end to our session today. I hope you enjoyed it. We will continue to monitor Ash over the next 7 to 10 days. We'll probably see her. Today is Wednesday. We'll probably see her maybe on Monday again, reassess her, and take it from there. Would you like to share with our followers where they can find you on social media should they want to book in a session with
Yeah,
you?
for sure. ADXB Sports Therapy. I come to you if you'd like to book. Just DM me and we can
Yeah.
make a plan. Yeah.
So Ash does all the fun stuff: cupping, dry needling,
Yeah.
instrument assisted soft
Yeah.
tissue. Yeah. And she's very familiar with exercise rehab. So
Yes.
if you're looking for a good massage therapist, a good sports therapist, contact Ash. All right, guys. Hope you enjoyed this video. We'll see you soon.